My name is Chris Nentars, and I really want to truly and genuinely thank you for your time. Time is our most valuable asset, and I promise I will make this session interactive and fun for you. So without hesitation, we're going to get right into things. Today is going to be a deep dive. So feel free to expand the slideshow or the screen as you need to catch the information that you want. Also, feel free to stop and go during the session because there's going to be a lot of information. We're going to be drinking from a fire hose this whole time because as we know, the science of how we apply our techniques is very, very important. So I am going to share my screen. As I mentioned, today's title is Percussive Therapy, Science and Application. And it's really important that as we go through today, try to connect the dots with how we really apply new technology, new techniques with our clients and patients. We're going to try to connect the content to the context of working with our clients, athletes, and patients. So our course objectives today are as follows. Number one, we're going to talk about treating various tissues and regions of anatomy. When I mean regions, it's not just, muscle chains or individual muscles. We're going to talk about neurology, and we're going to talk about where we could treat the body based on where Golgi tendon organs are or where muscle spindles are, and it's going to change the physiologic application and what happens to the body. Number two, we're going to understand science of percussive therapy with physiology and neurology in mind. We know that we can increase blood flow with manual therapy techniques. We can improve tissue glide. Our techniques also have an effect on the nervous system, and we're going to lean heavily into the nervous system when we discuss the modalities of percussion and vibration. Third goal, we're going to acquire a skill set to safely and effectively utilize percussive therapy in your environment. Obviously, rule number one is do no harm. So we'll talk about precautions and contraindications as well as best practices. Next, we're going to talk about communicating to our patients. A lot of times what we say is really, really important, and how we say things makes a big difference. We'll talk about that today. Next, we're going to learn the best practices for integrating percussive therapy into your treatment toolbox. It's really important that when we work with our clients and athletes, we have to be centered on what their needs are. Same thing today. So we're going to talk about this story of good, better, best. It's a journey that we're going to go on today. Everyone probably has used some type of percussive therapy device, whether it's Theragun or a different device or a different type of tool. That's good. But it's better to understand the science, and it's best to know how to meet your individual client's needs based on what their needs are. Next, we're going to understand how to implement percussive therapy for common conditions. We're going to talk about tendinopathies. We're going to talk about muscle restrictions. We're going to talk about activation and inhibition, all with the science underlying those. So then we'll simply show you how to apply those techniques. So again, that's me. I have almost 25 years of experience in the field. I'm a physiotherapist by practice, although I would consider myself more of a movement coach and manual therapist. I am currently the director of rehab and wellness at Thrive, which is a integrated interprofessional wellness and rehab center at DeWitt College in Buffalo, New York. So I come today speaking a little bit from Theragun. It's one of the current relationship I'm in, and I've been having a great time with them, talking about products. And what I love about their mission is that it's empowering people to feel better and be better naturally. Chronic pain is one of the largest expenditures in our healthcare system. And we have a solution for that, don't we? Yes, movement, getting people to feel better. Using manual therapy is a tool to getting people moving better. And the idea is we want to change people's behaviors so they could do these things on their own. And that's where tools can be a powerful ally in this battle. We believe in optimizing quality of life through education, programming, and products. It's not just the product. We have to have the education and programming behind it. Again, that's that sort of good, better, best story that we're going to follow today. We work with personal trainers, medical practitioners, licensed massage therapists. So at the end of the slideshow, you'll see some courses that we have. We have an LMT course that's great. We have a practitioner course that's great. They're digital or hands-on. That way you can either choose your own adventure with which one you want to do. But the idea is that we work together as a team. We always say teamwork makes the dream work. We understand that when we work with different providers, we make less errors. We find a more cultural competence way to execute our plan, and we find ourselves making less mistakes, which are all really, really good things, and we're able to reach the person's needs. So the idea is that 1 + 1 = 3. A year ago, when I joined Therabody, we only had one device. Now we've grown, and the idea that I want to express here is that there's no one single solution to wellness. There's a certain time to use different modalities to push the body along, and we know that. And especially if someone's in chronic pain, they need something to break the cycle. So what's great is we're starting to see a synergistic benefit in how we can utilize modalities and techniques. You're starting to see things like recovery lounges pop up, and the idea is that people understand that wellness is the key. And when we say wellness, it's not always performance. I was lucky enough to work at a high-level sports for years. I worked for Athletes Performance, now called Exos, out in Los Angeles, worked with U.S. Soccer. So I've been around, and I would see that sometimes performance didn't mean wellness, right? There's a little bit of a different gap there. So we want to talk about wellness as in the whole person. And that's why we talk about using different modalities and different techniques. As I mentioned before, our approach is good, better, best. Good to have the right tool, better to know the technique, best to know how to apply it based on your client's, athletes, or patient's needs.